I'm delighted to be part of the CAF 2 project. In my view, it's one of the most exciting projects to come to this region in the last decade. And that's quite a bold statement to make. But I can tell you and give you absolute assurance that Southampton City Council, Hampshire County Council, Portsmouth City Council, the NHS, and all our partner organisations are wholly behind this project and wholly endorse everything we're trying to achieve. In the past, various professionals have tried to get together and deliver some of these things. And you'll notice today, by inviting yourselves to come along to this project, we've got a high ratio of citizens to care professionals. Today is really about trying to let yourselves have a go and to help us achieve some of our goals. This is a familiar scene, and it's a slide that I've seen at various points of the last 7 years. It really just illustrates how in the centre you have people trying to share information, and there are lots of professional organisations and individuals involved in delivering care to somebody. Now this is true when somebody has an episode, has a fall, or presents at hospital, but it's also true on a day-to-day basis when somebody has their social situation and support network around them. They are having to deal with various professionals in various guises. Most of these organisations and people will keep a record about yourself. Not all of them share information, and that of course is a big problem for us. I'm going to introduce the concept of the Hampshire Health Record. Now, the Hampshire Health Record is a system you may well have heard of before. It's had various names in the past, and despite it being called the Hampshire Health Record, it does belong to the wider Hampshire, so Southampton is part of that, as is Portsmouth. The slide here with the arrow shows that what we'd like to happen is show that there are various people involved in assessing somebody and involved in delivering care to somebody. What we'd like to see is everybody being able to contribute to one core central record for every individual. Everyone contributes to it. Ultimately, that record belongs to nobody else other than the individual. And what we'd also like to happen is that information can be updated by the citizen, by yourselves, and as appropriate, that information can be pulled back into the respective systems. That in itself is a bold idea as well. And although we've done a lot in the last few years, I think we can take, in this project, a lot of the good things that we have done and we have delivered over the last 5-6 years. But I think this project is about being brave enough and being bold enough to tackle some of the issues that we are all aware of. And also to take on the chin that this is an opportunity for us to try things out. And we won't always succeed, but over the next 2.5 years we should have some good ideas, have an opportunity to try things out, and hopefully we're looking forward to working with yourselves to help us achieve our goals.